right, everybody, we're going to cruise on to question number 3. The title of this article is Predictors of Patient Satisfaction and Survey Participation After Spine Surgery. It's a retrospective study, a review of over 17,000 participants, consecutive spinal patients from a single academic institution. So this is part 1. It's about Press Ganey questionnaires. And it was written by Benjamin Hopkins in the Journal of Neurosurgery in 2019. So this is a pretty recent article. But yes, and it had
it's got a decent population size at just almost 18,000 people.
Yes, and all from the same institution, which is kind of cool too. So they know, I liked that part of this article because they're giving the same patient the same exact thing. So when you kind of have a study that's going across like many different institutions, it's hard to keep everything the same.
Yeah.
All right. Your question is, how are positive satisfaction scores by patients earned? So A, are they earned by the competence of the provider? B, with a positive interaction from the clinical staff? Or C, they're not earned, but lost by the performance deemed less than optimal by the patient?
Interesting. So C is, there's no way to improve it, but you certainly can reduce it.
Mm-hmm.
It's like arguing with your wife. Like there's no win. There are only grades of losses, right?
Oh, come on, Josh. That can't be true. And there was something.
I didn't get a smile out of Laura Maria, so I'm like worried now.
The only other male is the one that was like, yeah.
Oh, man. But yeah, so these are in, remember, so these are the Press Ganey surveys. And interesting on this one, too, that I don't know if it'll help you with the answer, if it's going to make the answer more difficult, but a little information about it was only 10.8% of participants actually filled out the questionnaire. Yeah. So.
Interesting.
Wow, right. Maria.
Yeah. And I'm wondering how they measure, how you would measure competence. That's what's in, that's.
All right. Your time is up. So let's go around and see. Okay. I got C's. Okay. So Maria had C, Dwayne had C, Lauren had B, and Josh had C. And your answer is C. Which I thought was actually kind of interesting because you would think that like as a patient, you're seeing, okay, like my doctor's doing good. Like that would give him a point. My nurse was really pleasant. I'd give her a point. My staff instruction was great. I'll give them a point. But instead, it's more of like people don't say anything unless there was a problem.
I actually read this study a few years ago because I'm a nerd. But the other thing that I thought was interesting about this, when you said like what percentage of people didn't fill out the survey, I believe, if I remember right, there was a certain time marker. So these are like after spine surgery. These people are in the hospital for like at least a couple days. But I think if you delayed them like 2 days or something, they wouldn't fill out the survey and they'd just be like upset. So it's like, even though they had a major procedure, they were like, I just want to get home. And they kind of got to this point where they're like, I don't care what you're asking me to do. I'm not going to do any of it, you know? Mm-hmm. So yeah, that's the only part I remember about that study.
Yeah, it was interesting in the essentially post-operative, a lot of the studies that I've read that have been like post-operative, it's really like if everything went as it was supposed to be, nobody says anything. But if they had a complication or if they had an issue, then they're like, I'm filling out that survey. So, I mean, patient communication wise, like how can we get them to actually fill out these surveys like before and after so we can actually get a better reading on how well the like performance of the staff is doing would be ideal.
Yeah.
I don't really know.
I would like to see how many of the surveys were just found torn up on the floor by, next to the patient's bed. Like
Maria.
I mean, I just don't know how, I don't really know. I mean, being in nursing for 14 years, I don't really know. I'm not surprised with the 10% that answered because that's usually what it's around anyway. It's like 10 to 15% on average. And looking at the answers, I mean, just even thinking about the number of patients I've dealt with, like, do they care about the competence of the provider? Yes. Do they care about a positive interaction with clinical staff? Yes. Like, they care about all of that. It's not just those two specific things, like one is equal or one is better than the other. It's everything combined. it was interesting the way that they worded, it's not earned, but lost. Because it's true. I mean, they could, like Dr. Josh was just saying, like they could walk away and you were saying, Melanie, like everything was completely fine. They're not going to fill it out. If they had something that was like more than optimal, you know, they might do it because they feel like they want to make a difference. Like they want the provider to have, and the staff to, you know, have good reviews and word of mouth too. I mean, I would say like satisfaction scores, yeah, they're important. I know like Prestani, but it's also about the word of mouth too.
What Google review they're going to write?
Yeah. Or who they're going to tell.
Hey, Josh, we can't hear you anymore.
I was cussing a lot, so I didn't want it to be recorded. No,
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Join us next week for more laughs, new guests, and fresh questions that turn medical research into pure fun. Trust Driven Trivia, making healthcare knowledge exciting, one question at a time.